Dear learners, welcome to this presentation on Posology. After watching this video, the learners will be able to define posology, understand and know the factors influencing dose. Now let us see what is posology. The word posology is derived from the Greek words posos means how much and logos means science. Together, both these words form posology. Hence, we can define posology as it is the branch of medical science which deals with dose or quantity of drugs which can be administered to a patient to get the desired pharmacological actions. Now let us see different factors influencing dose. First is age, sex, body weight, route of administration, time of administration, environmental factors, emotional factors, presence of disease, metabolic disturbances, accumulation, synergism, antagonism, habituation and addiction, idiosyncrasy, hypersensitivity, tolerance, and finally tachyphylaxis. Now let us see one by one each of these factors. First factor is age. In determining the dose of a drug, the age of an individual is of great importance, especially in young or very old persons. Children and old persons need lesser amount of drug than the standard dose because they are unable to inactivate or excrete drugs to that extent as adults. Children can tolerate relatively large doses of digitalis and belladonna. Newborn infants are abnormally sensitive to certain drugs because of immature state of their hepatic and renal function by which drugs are normally inactivated and eliminated from the body. Next factor is body weight. Generally, recommended adult doses are based on a normal body weight of 70 kg. But such a dose will be too less for a muscular person weighing 100 kg and too large for a weak person weighing about 50 kg. The calculation of doses for children on the basis of body weight is considered more dependable than that based strictly on age. Doses calculated according to body weight are expressed as mg per kg. Next factor influencing dose is sex. Females require lesser dose than males because of their lesser body weight. Also, they are more responsive to the effect of certain drugs than males. The drugs should be given very carefully during menstruation, pregnancy, and lactation. In menstruation, strong purgatives should be avoided during menstruation. In pregnancy, the drugs which stimulate contraction of uterus should be avoided in the pregnant ladies, which may lead to abortion or miscarriage. Drugs like alcohol, barbiturates, narcotics, which are readily transported from mother to the fetal circulation, should be avoided. These drugs produce adverse effect of the fetus, sometimes resulting in death of fetus in the uterus. In case of lactation, during lactation, drugs such as morphine, tetracyclines, which are excreted in milk, should be given very cautiously to the mother who are breastfeeding the babies. Next factor is route of administration. The dose of a given drug may vary according to the dosage form and route of administration used. The drugs administered by intravenous route enters, enters the bloodstream directly, hence require lesser dose than the subcutaneous dose, which in turn is smaller than the oral dose. Here we can see that dose required for intravenous route is lesser as compared to intramuscular route, whereas dose required for intramuscular route is lesser as compared to subcutaneous route, and finally dose required for subcutaneous route is lesser as compared to oral route. Next factor is time of administration. Drugs are rapidly absorbed from the empty stomach, hence an amount of drug that is effective when taken before meal may be ineffective if administered during or after meals. Irritating drugs are better tolerated if administered after meals, which will dilute the drug and reduce the gastric irritation. For example, iron, arsenic, cod liver oil should always be given on a full stomach. Next factor influencing dose is presence of disease. Drugs are more effective in diseased conditions than normal body conditions. For example, during fever, one can tolerate high doses of antipyretic drugs than in a non-febrile condition. Similarly, during hepatic or renal disturbances, the drugs which are metabolized in the liver or excreted through the kidneys may become dangerous. Next factor influencing dose is environmental factors. Alcohol is better tolerated in cold environment than in summer. Also, the dose of a sedative required to produce sleep during daytime is much more than the dose required to produce sleep during night. Next factor influencing dose is metabolic disturbances. Change in water electrolyte balance and acid-base balance, body temperature, and other physiological factors may modify the effects of drugs. For example, salicylates reduce body temperature only in case an individual has rise in body temperature. They have no antipyretic effect if the body temperature is normal. Next factor influencing dose is accumulation. When a drug is repeatedly administered for a long time, depending on its nature, it may be unexpectedly accumulate in the body to produce sudden toxic symptoms. The drugs which produce such symptoms of poisoning are called cumulative drugs. The cumulative effects are usually produced by slow excretion, defective degradation, and unexpectedly rapid absorption of drugs. So the drugs like digitalis, ibintine, bromides, heavy metals should be carefully administered. But cumulative effect is desirable in drugs like chloroquine and phenobarbital, which are used in cases of malaria and epilepsy respectively. Thank you for your patience listening. These factors are covered in this part 1 video. For remaining factors, you can watch my second video on Posology part 2, in which the factors like synergism, antagonism, emotional factors, habituation and addiction, idiosyncrasy, hypersensitivity, tolerance, and tachyphylaxis. These factors are covered in my next video. Thank you for your patience listening. Keep learning. If you like this video, press the like button, and for more videos, please subscribe to my YouTube channel. Thank you.